Hi, I'm Dr. Diamondberg, Chief of Orthopaedics at St. Mary's. Our whole team is here for you. Your optimal recovery after knee replacement surgery requires that you take an active role in your rehab. This video describes some of the important physiotherapy principles and exercises you will need. While most patients will require 2 to 3 days in the hospital after surgery, with the improvements in pain control and advancement in surgical techniques, some patients will be able to go home on the same day as your surgery. Your surgeon will tell you which pathway is best for you. Regardless of whether you are staying in the hospital or going home, following the rehab information contained in this video will greatly facilitate your recovery.
Hi, my name is Jenny. I'm a physical therapist at St. Mary's Hospital. Today I'm going to teach you what you need to know regarding your upcoming surgery. In this video you will learn about your restrictions, sleeping positions, transfer techniques, what to do when walking with an assistive aid, how to go up and down the stairs, and also the exercises that you will be doing after your surgery. So now we're going to talk about the restrictions and the sleeping positions. For the purpose of this video, we are going to use this leg with the stockinette as the operated leg. So the first restriction, you are not allowed to put a pillow under the knee. So for example, this is not allowed because we do not want the knee to be stiff in a bent position. However, you are allowed to put the pillow under the heel, because this will promote the knee extension, which is important when you are walking. The second restriction is to avoid any twisting movements at the knee. When you are standing and you want to turn, your feet and your shoulders have to point the same direction. So now we're going to talk about the sleeping positions. You can sleep in any position that is comfortable to you. If you are sleeping on the side, it is more comfortable to have a pillow between the legs. As such, if ever you sleep on your stomach, that might not be a comfortable position right after the surgery, as the incision will be in the front and you will be pressing onto the bed. So now we're going to talk about the transfers out of the bed. So how to go from a lying position to a sitting position. It is easier to get off of the bed from the unoperated side, so from this side here. However, it's not contraindicated for you to get off on the same side. So to get out of the bed, first you have to come a bit closer to the side of the bed. To do so, you're going to bend the unoperated leg up, put your hands down, and lift your buttocks closer to the side of the bed by sliding a bit the leg. In this position, you're going to put the unoperated leg down and use your hands to push your upper body up. Now there's 3 options that you can use to bring the operated leg down on the side of the bed. So the first one is by using your hands right above the knee and bringing it to the floor while always keeping the operated leg a bit forward. The second option is to use a towel. So you're going to put the towel right under the knee. In this position, again, you're going to put the unoperated leg down, and now you're going to use your hands to swing the leg down to the floor, always keeping the leg straight and a bit more forward. Okay, come back. And finally, the last option is by hooking the good leg under the operated leg, and in this position, swing your legs down, while keeping the legs straight and a bit more forward. When you come into the hospital, make sure that you have proper shoes. Your shoes should be closed in the back so that it prevents slipping, and we suggest old running shoes because they're easy to open in the front as your foot is going to swell up. Ballerina shoes are not recommended as they are hard to put on. Make sure to adjust the walker at your own height, so when you're standing with your arms loose, the handle of the walker should land on the crease of your wrist. Now to stand up, make sure that your operated leg is straight in front of you. You're going to bring the walker closer to you. Bring the unoperated leg a bit more backwards. And from this position, we're going to stand up by using our hands. Make sure that your hands are on the bed or on the chair, but not on the walker. Use your hands to push yourself up using your unoperated leg, and now you're going to hold on to the walker. In this position, you're going to slide the operated leg backwards, and now you're standing. So now in this position, you're going to put a bit more weight on the operated leg. Remember to use your arms on the walker to relieve any pressure if your knee is hurting. So now we're going to start walking. First off, you bring the walker forward, followed by the operated leg, and then the non-operated leg. Walker, operated leg, non-operated leg, and again. To go back to the bed, you have to feel the bed behind your knees. In this position, you're going to slide your operated leg forward. Put your hands on the bed to slowly sit down. Now here, to bring the operated leg back into the bed, you have the three options that we spoke about earlier. You can either use your hands to bring your leg up, or you can use the towel, and the third option, you can hook your unoperated leg behind the operated one and swing it back up. Once you're in the bed, you can move your buttocks more to the middle of the bed. To go up the stairs, if you have a railing at home, you hold on to it, and automatically the other hand will hold on to the cane. To go up the stairs, you're going to bring the non-operated leg up first, followed by the cane, and then you push up, bringing the operated leg onto the step. Again, non-operated leg first, then the cane, followed by the operated leg. Again, non-operated leg first, cane, and then the operated leg. So coming down the stairs, this time you're going to put the cane first, followed by the operated leg, and then the non-operated leg. Again, cane, operated leg, and then the non-operated leg. And you repeat. So now let's look at the exercises that you will be doing after the surgery and also at home. So now the first exercise is to move your feet up and down. And you can also do little circles. This is to be done ideally 10 times every hour to activate your circulation and to prevent blood clots. So the exercise, we are going to ask you to push the knee firmly down into the bed to get a contraction, and you are going to hold it for 5 seconds. 1, 2, 3, 4, and 5. Relax. And you go again. 1, 2, 3, 4, and 5. For the third exercise, roll up a towel and place it right under the knee. Here you're going to keep the ankle pointing upwards. Push the knee down onto the towel while lifting the heel up as high as you can, and you will be keeping this contraction for 5 seconds. And relax. And again. 1, 2, 3, 4, 5. For the fourth exercise, you're going to be putting a towel right under the knee. And in this position, you're going to hold it with your two hands and you're going to pull it towards you to bend the knee up. Bend it as high as it can until you feel a stretch, but you shouldn't have pain that is more than 3 on 10. And then you release it down. And you repeat it again. For the fifth exercise, we will be asking you to squeeze your buttocks muscles. Go ahead for 5 seconds. 5, 4, 3, 2, 1, and relax. For the sixth exercise, we're going to ask you to bend up the non-operated leg so that the foot is flat on the bed. Put your hands down on your sides, and here, while squeezing your unoperated leg, lift up your buttocks towards the ceiling. You hold it for 5 seconds, and then you relax. For the seventh exercise, you will be in a sitting position. Here, we're going to ask you to contract your quadricep muscles to lift up the foot so that your knee is completely straight. We're going to keep the contraction for 5 seconds, and then we're going to slowly relax. So the last exercise, you will be sitting in a chair with a towel under your foot. In this position, we're going to ask you to try and bend the knee as much as you can while sliding the heel towards you until you feel a good stretch. You should not have pain more than 3 on 10. Hold it for 5 seconds, and then you can release. So ideally, the exercises should be done daily, 3 times a day, with 10 repetitions, except for the ankle exercise that we ask you to do 10 times every hour.